The cage lid should be removed carefully to avoid excessive disturbance to the animals. The mice should be allowed sufficient time to become aware of your presence. The first mouse to be injected should then be restrained smoothly, without hesitation, by grasping the base of its tail between your forefinger and thumb. The mouse should then be lifted from the floor of the cage onto your arm or onto the cage lid, while maintaining a firm grip on the base of its tail. Pulling back gently will cause the mouse to grip the bars of the cage lid with its front paws. Using the forefinger and thumb of your second hand, draw up the loose skin from over the shoulders and hold securely so as to restrict movement of the mouse's head. Then, while maintaining a firm grip on the scruff and the base of the tail, lift the mouse and transfer it into a restraining device. Intravenous injection is made into the lateral tail veins and is made easier if the vessels are dilated. This can be achieved either by warming the mouse in an incubator for 30 minutes before the procedure, or by dipping the tail in warm water for a minute or so. It is relatively easy to identify the tail veins in an albino animal, but much more difficult in pigmented strains of mice. The mouse's tail is restrained and the needle is introduced with its bevel uppermost into the vein, at a distance approximately halfway to 2/3 from the base of the tail. The vein lies immediately below the skin, and entry of the needle into the vein is easier if the tail is bent slightly over the operator's finger, and the needle introduced almost parallel to the tail. There should be almost no resistance when the syringe plunger is depressed, and the vein should be flushed clear of blood as the injection is made. The injection should be made slowly and steadily, taking great care to avoid any changes in the position of the needle and tail. After the injection is carried out, the needle is withdrawn and gentle pressure applied to seal the vessel and allow clotting to occur. Once bleeding has stopped, the mouse is placed back in its cage and released. When releasing the mouse, maintain a secure grip until its feet have made contact with the cage floor, then gently release it. Prior to release, it may be identified, for example with a tail mark, to confirm that the injection has been administered.